Wonderful. Well, thank you again, Dr. Rishi. It's a real pleasure to be here to talk to you about how drones are already helping governments to meet their objective of saving lives and protecting people's health by increasing equitable and sustainable use of vaccines and other life-saving products. One of the big lessons learned from the pandemic is that supply chains, no matter in what industry you are from, need to be more responsive and resilient. Well, at VillageReach, we believe that drone is one of the solutions, definitely not the only one, but one tool in the toolbox for building the next generation of health supply chains. Supply chain more agile, more responsive to the needs of the communities. All in all, ensuring that everyone, no matter where they live, has access to high quality healthcare. VillageReach has been working for the last 20 years to improve the way health products such as vaccine, medicine, laboratory samples are transported in low and middle income countries where we work. And at VillageReach, we aspire to a world where every individual on earth has access to the healthcare services she and he deserve to thrive. Let's not forget that not everyone is as lucky as us. Most of us can get in our car or even take public transportation. And in 5-10 minutes, we can get basic medicine like cough syrup or even life-saving vaccine like the COVID-19 vaccine. This is not the reality for more than 1 billion people who live further than 2 kilometers away from an all-season road. It's not the reality for almost 30% of the population of sub-Saharan Africa who live more than 2 hours from the nearest hospital. And it's not the reality also for 10 million children who live in remote area and have never received a vaccine. Drones have the potential to play a transformative role, particularly in healthcare, where they allow us to overcome challenges in infrastructure and logistics, optimize supply chain system, making them more effective and reliable, resulting in increase of the health worker efficiency as they spend less time on fetching product and more time on actually taking care of their people. In addition to the potential lives saved or improved through timely access of medicines, there is a social economic spillover effect. A healthier workforce for the country, an increased confidence in the public health system, and job created by exposing the future generation to the latest aerial technology, allowing them to develop valuable new skills. Drone can also spur new investments and open the door to infrastructure improvement, advanced aerial sensing application, as we've seen throughout the conference, and advanced air mobility. Since 2015, VillageReach has been at the forefront of the exploration of drone technology to transport life-saving products in challenging environments. As of today, VillageReach has conducted 5 drone delivery projects in 5 countries, and 3 of them are currently active. The one in Malawi and DRC that I'm gonna expand on in a few minutes, as well as Mozambique. Next year, our goal is to scale up drone deliveries to serve over 225 health facilities that are serving over 3 million people in the DRC, the Democratic Republic of Congo, Malawi, and Mozambique. VillageReach oldest medical drone delivery program is in Malawi, in fact, and especially in the southern part of Malawi, where the government has struggled for years to maintain consistent and reliable medical deliveries due to a lack of road infrastructure and yearly flooding season. Since January 2020, with support from UKAID, FTL, and UNICEF, drone has been integrated into the health supply chain to supplement ground logistics, which happen in bulk every month. And I will expand on another use case in DRC where drone is used not to supplement, but it is the only way to deliver. I will get to that in a second. But in Malawi, Super, which is the drone service provider we are partnering with, has demonstrated already that we can dramatically reduce travel time from a 90-minute car ride become a 9 minutes drone flight. This is even more important during the rainy season when roads become impassable. A 3-hour journey by boat became a 12-minute flight. This significant reduction of travel time creates new opportunities to optimize the health supply chain system and reach more people in a more efficient, in a more responsive way. The introduction of drone into the health supply chain has literally resulted in reshaping the health ecosystem. Since last May, VillageReach has taken over the program, and you can see some of the encouraging results after just 6 months of ongoing operation. And starting this month and through October 2020, we will not only sustain this drone delivery operation in the south, but more importantly, we will scale up the drone delivery network to 20 out of the 28 districts in the country and help the government ensure equitable access of life-saving products and services in over 105 health facilities identified as the hardest to reach when using traditional mode of transportation. VillageReach's most advanced drone program is the one in the Democratic Republic of Congo, where we have partnered with the government and the local civil aviation authorities to integrate drone delivery into the public health supply chain of the country. And as we speak, a fleet of 6 drones is currently flying 6 days a week for over 22,000 square kilometers of equatorial forest, delivering health product, picking up lab sample to accelerate the diagnosis of various diseases that are devastating the region, like polio, Ebola, or even COVID-19. Not like in Malawi, the whole point of our program in DRC is to serve very remote population living in hard-to-reach facility for which the traditional supply chain fails to deliver health products. So not like in Malawi, if the drones are not flying, people are literally not receiving the health service they need, and the life of their entire community is in danger. We started pilot flights back in 2018 and began routine flights on December 30, 2020. And you can see here how much has been accomplished. Again, you can see some really encouraging results, but also these numbers may not seem like a lot to you, but again, remember that drones are only serving remote population living in a hard-to-reach facility. We are not trying to deliver to every single health facility. And if you look at immunization supply chain performance, you can see that just after 6 months, you have a baseline and the midline that was done after 6 months. We already have some very encouraging result in terms of increase of vaccine availability, decrease of stock out, as well as increase of percent of sample arriving on time at their destination, as well as percent of facility that are stocked according to plan. So all this is showing you that the drone, when it's maintained in an ongoing fashion, is really starting to have positive impact on the performance of the health supply chain. And I'm gonna take, I think I do have time, I'm gonna show a 1-minute video Actually, it's not there. It's right here. I hope you can still see my screen. Doesn't matter the sound. So you can see it's while it's receiving medicine, is unloading, reloading the drone to bring back, in this case, some documents. You see the condition where the population that we're serving. Great. Well, I hope that the video gave you a sense of how life-changing drone technology can be for millions of people who live in remote location far away from any hospital or clinic. The drone delivery service in DRC is being used for routine scheduled delivery, for emergency delivery, but over the last year, we have witnessed an increase of the demand and utilization of the drone delivery network. And this is the living proof that drones are changing attitudes and the way people think and solve problems related to inventory and order management. For example, now the logisticians has another solution to deal with unpredictable demand of some medicine, or medicine has short shelf life, stock out, even waste management. You can bring back expired product. Drone has the potential to really to leapfrog all those challenges around cold chain management and performance at the destination. Electricity storage at destination, why would you need to have a large capacity to store if in a matter of minutes you can receive whatever medicine you need using the drone network? All of a sudden, the logisticians and supply chain experts have access to an additional mode of transportation, a mode of transportation that is agnostic to the cargo they transport. Going from blood, medicine, vaccine reports, and even orders, delivery orders, and stock inventory report, and so on, epidemiologic reports. A mode of transportation that is flexible to the use cases. You can use it for emergency, or routine, or on-demand, or even to support campaign. With drone, logisticians have another tool in the toolbox to improve the health supply chain performance. I want to finish with one, giving you a story that just happened last month in the DRC, and where the provincial minister and their partner WHO and UNICEF has actually requested to use the existing drone delivery network to support a yellow fever campaign in the Equateur province. And for me, this is a perfect example where people are thinking out of the box. And in this case are willing to leverage an existing drone delivery network to vaccinate as many people as possible during this 4-day vaccination campaign. The drone allowed for just-in-time delivery of yellow fever vaccine to the campaign team as the campaign progressed in the region, limiting the need for cold chain equipment. The drones allowed on-demand resupply of all sorts of product. Yes, the yellow fever vaccine, but also they ran out of vaccination cards. Well, in a matter of minutes, they were able to receive new cards to continue the campaign. Well, you can imagine if in the middle of the campaign where they are hours and hours away from the provincial level where these actually cards, they would not be able to continue, and that would have impacted the success of the campaign. And also often during a vaccination campaign, epidemiologic surveillance activities are intensified. In this case, drone allowed for quick transport of samples from the health facility to the provincial level for being processed. Again, drone have the potential to transform healthcare and in the process, change our attitudes and behavior on how we operate our daily life. And you're probably thinking, well, these are great initiatives, but how do you sustain them beyond 6 to 12 months, and evolve towards a non-donor dependent financial responsibility? Well, you have to recognize that we are still in a phase where we are only thinking monosectorial with heavy technical assistance from a partner like VillageReach. And we heavily depend so far on by multilateral donors, foundation donation, as well as, let's not forget, this is significant, government in-kind contribution. But we have to start changing our mind and evolving towards a multi-sectorial use cases with progressively less technical assistance, where you identify some new customer who will be actually pay a fee for service. And so you develop, all of a sudden, your drone service provider become a 3PL, a three-party logistic with service level agreement with various customers. And all of a sudden, the resources are, you may have some catalytic funding still from donors, but then you start generating some revenue from varieties of new customers that are with a service level agreement. And then you also have, you should longer term donor backed government fund, like for example, the World Bank GFF mechanism. And progressively start continuing the transition towards a full-on 3PL, 4PL mechanism, where you have the 3PL, who is the drone service provider, who has contract with lots of different customers across the sector. You have a 4PL, the government or local partner who providing the oversights and the evaluation of the 3PL. And all of a sudden, you have actually customer paying for the service with either a commercial rate, and you have rates that are subsidized that the government can start budgeting in their own budget, annual budget, for those subsidized fee for service. So this is our vision at VillageReach of how we have to evolve to be less dependent on donor funds. And at VillageReach, we are starting the step 2 where we are starting to identify additional customers who are able to utilize an existing drone delivery network for their businesses. So as the world undergo a great recess in light of the pandemic, our ability to harness and disseminate new technology like drone will play a key role in ensuring our recovery from the pandemic and the avoidance of the future crisis. Drone technology deployed appropriately should be used as the baseline to reinvent the way we operate in this new context. Drones are also an opportunity to dream and be inspired by a brighter future, like these young Congolese children who got inspired and built their own drone after they saw drone flying in their villages and spent a lot of time hanging around our team of drone pilots and operators in the Democratic Republic of Congo. Thank you for your attention, and any questions, please go ahead.
Can we have questions, please? Meanwhile, I can ask a couple of questions, Oliver. You know how much I love asking questions to you.
Go ahead, it's a pleasure.
Okay, so how do you see the perception changing of different industries? Like you said that it could be way more scalable or affordable or feasible if we do more than healthcare, if the same network can serve many more sectors. So today we're talking about drones in development, and development would mean a sustainable development or a holistic development for the whole community. So how do you see the perceptions changing, let's say, of the farming community, of sending their farming produce over, or other companies? Are they opposed to it? Like if we start competing with the existing logistics network or courier company, how do they look at the drones? Do they see it as a competition, welcome, unwelcome?
That's a very, very good question, and really critical question as you start thinking about sustaining. And as you said, there is trend towards affordability and cost efficiency only when the operation at that scale was a high utilization rate. And we've seen both in Malawi and in DRC, where we've been flying for over 15 months now, 15 months, 2 years, that people are starting to realize, first of all, being less scared of it, starting to understand the why and its potential, and are starting to ask question around, could we use this for my purpose in agriculture, for example? It's starting to generate interest from the communities and from businesses. And this is what I'm talking about. It's now you don't know what you don't know. Head of businesses, local businesses, they don't know how to even place this additional mode of transportation into the business. We have to go out and work with them and trying to understand their challenges, and then together think about, would drone be a solution? Again, drone is only a mode of transportation. It's not a solution to every problem. But right now, what we do, part of the community sensitization, which is, by the way, an ongoing, it's not before, it's before and during and again and again and again. We are starting to, we start including during those outreach discussion with business owner and with business owner to help them go through the process. Would drone help them with their businesses? And that's how we believe the utilization, the increase of the demand is going to happen. And with increased demand, increase of utilization, that is when the financial aspect will start making sense.
Sounds right. And how difficult would that be to implement? Like, do you see that a lot of people would be required to do that kind of engagement, or can we utilize the local leaders to do that for us? Can we collaborate with them? How do we work?
Yeah, so it's gonna take time, but the way we are approaching it is that first, let's seek customer who could use an existing network. So for the last few years, we were able to deploy drone network in Malawi and DRC. In Malawi is gonna be almost to the entire territory. And how is there a customer or that could benefit from an existing network? And so in that way, we can look at the extra capacity of the current network and basically sell that capacity to customers so it's not going to cost them the whole deployment, the whole network, but only they will buy a certain capacity to utilize an existing network. And so that's where I think we're going to learn a lot. And again, it's going to be a journey. It's not going to happen in the next year, or yes, additional customer, hopefully yes, who will start having some service level agreement and start paying for a certain capacity. And then progressively, we believe that demand will increase because you are exposing businesses with the solution that they can start understanding how it would fit into the business model and services, I should say.
Thank you very much, Olivier. This was really insightful. So I don't think there are any more questions. If there are, maybe you can raise your hand and ask, or you can move to the chat. I guess, Olivier, we'll pause here for your presentation. Thank you so much for being a part of our conference. It's always a pleasure having you around and learning from you. And we hope to continue working with you in the future. Thank you.
Thank you, Dr. Rishi. Thank you, everyone.